Hello guys, and welcome back to my YouTube channel. In this video, we are talking about symptoms, causes, and treatment of a heart attack. Before we continue our video, make sure to subscribe to our channel and hit the bell icon for more videos. So, let's get started. What is a heart attack? A heart attack happens when something blocks the blood flow to your heart so it can't get the oxygen it needs. More than 1 million Americans have heart attacks each year. Heart attacks are also called myocardial infarctions. Myo means muscle. Cardiophyl refers to the heart, and infarction means the death of tissue because of a lack of blood supply. This tissue death can cause lasting damage to your heart muscle. Heart attack symptoms. Symptoms of a heart attack include discomfort, pressure, heaviness, tightness, squeezing or pain in your chest or arm or below your breastbone. Discomfort that goes into your back, jaw, throat, or arm. Fullness, indigestion, or a choking feeling. It may feel like heartburn. Sweating, upset stomach, vomiting, or dizziness. Severe weakness, anxiety, fatigue, or shortness of breath. Fast or uneven heartbeat. Symptoms can be different from person to person or from one heart attack to another. Women are more likely to have these heart attack symptoms. Unusual fatigue, shortness of breath, nausea or vomiting, dizziness or lightheadedness, discomfort in your gut. It may feel like indigestion. Discomfort in the neck, shoulder, or upper back. With some heart attacks, you won't notice any symptoms. A silent myocardial infarction. This is more common in people who have diabetes. Heart attack causes. Your heart muscle needs a constant supply of oxygen-rich blood. Your coronary arteries give your heart this critical blood supply. If you have coronary artery disease, those arteries become narrow and blood can't flow as well as it should. When your blood supply is blocked, you have a heart attack. Fat, calcium, proteins, and inflammatory cells build up in your arteries to form plaques. These plaque deposits are hard on the outside and soft and mushy on the inside. When the plaque is hard, the outer shell cracks. This is called a rupture. Platelets, disc-shaped things in your blood that help it clot, come to the area, and blood clots from around the plaque. If a blood clot blocks your artery, your heart muscle becomes starved for oxygen. The muscle cells soon die, causing permanent damage. Rarely, a spasm in your coronary artery can also cause a heart attack. During this coronary spasm, your arteries restrict or spasm on and off, cutting off the blood supply to your heart muscle. Ischemia. It can happen while you're at rest, and even if you don't have serious coronary artery disease. Each coronary artery sends blood to a different part of your heart muscle. How much the muscle is damaged depends on the size of the area that the blocked artery supplies and the amount of time between the attack and treatment. Your heart muscle starts to heal soon after a heart attack. This takes about 8 weeks. Just like a skin wound, a scar forms in the damaged area, but the new scar tissue doesn't move the way it should. So your heart can't pump as much after the heart attack. How much that ability to pump is affected depends on the size and location of the scar. What do I do if I have a heart attack? After a heart attack, you need quick treatment to open the blocked artery and lessen the damage. At the first signs of a heart attack, call 911. The best time to treat a heart attack is within 1 or 2 hours after symptoms begin. Waiting longer means more damage to your heart and a lower chance of survival. If you've called emergency services and are waiting for them to arrive, chew on aspirin, 325 mg. Aspirin is a potent inhibitor of blood clots and can lower the risk of death from a heart attack by 25%. What do I do if someone else has a heart attack? Call 911 and start CPR. Cardiopulmonary resuscitation. If someone goes into cardiac arrest, which is when the heartbeat has stopped and the person isn't responsive, CPR doesn't restart the heart, but it keeps the person alive until medical help arrives. An easy-to-use device called an AED, Automated External Defibrillator, is available in many public places and can be used by almost anyone to treat cardiac arrests. This device works by shocking the heart back into a normal rhythm. Here's how to use an AED. 1. Check responsiveness. For an adult or older child, shout and shake the person to confirm whether they're unconscious. Do not use AED on a conscious person. For an infant or young child, pinch their skin, never shake a young child. Check breathing and pulse. If absent or uneven, prepare to use the AED as soon as possible. 2. Prepare to use AED. Make sure the person is in a dry area and away from puddles of water. Check for body piercings or outline of an implanted medical device, such as a pacemaker or implantable defibrillator. AED pads must be placed at least 1 inch away from piercings or implanted devices. 3. Use AED. For newborns, infants, and children up to age 8, use a pediatric AED, if possible. If not, use an adult AED. Turn on the AED. Wipe the chest dry. Attach pads. Plug in the connector, if necessary. Make sure no one is touching the person. Push the Analyze button. If a shock is advised, check again to make sure no one is touching the person. Push the shock button. Start or resume continue compressions. Follow AED prompts. 4. Continue CPR. After 2 minutes of CPR, check the person's heart rhythm. If it's still absent or uneven, give them another shock. If a shock isn't needed, continue CPR until emergency help arrives or the person begins to move. Stay with the person until help arrives. Heart attack treatment. A heart attack is a medical emergency that needs immediate care to prevent permanent heart damage or death. Treatment often begins in the ambulance if you call 911 or in the emergency room if someone else took you to the hospital. What drugs are used to treat a heart attack? At the emergency facility or hospital, you'll quickly get drugs to prevent further blood clotting in the heart and ease the strain on the heart. Drug therapy aims to break up or prevent blood clots, stop platelets from collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. You should get these medications as soon as possible, within 1 or 2 hours from the start of your heart attack if possible, to limit heart damage. Hope you guys enjoyed our video. For more videos, make sure to subscribe to our channel and hit the bell icon for more videos.